Okay, a sensitive subject for a lot of folks, gender-affirming care for children. There's growing scrutiny of research supporting hormone and other treatments for kids wanting to transition away from the gender they were assigned at birth. And some countries are actually taking a step back from allowing the procedures. Here's NewsNation investigative correspondent Rich McHugh with an update on America's fight over transgender medicine.
The outcome of this process will harm Floridians.
Tensions running hot inside the Florida Board of Medicine meeting in November.
Excuse me, security, please escort that person out.
That proud transgender woman.
Convened to rule on allowing treatment and surgery for adolescents who want to change genders.
You will not live the moment down. Every person that kills themselves because of this, that I know, I will make sure their family contacts you. The blood is on their hands.
The Florida Board of Medicine ultimately restricted hormones, puberty blockers, and surgeries for adolescents, with the stipulation that those already receiving treatment or in clinical trials could continue.
Please join us in opposing this rule, opposing the politicization of healthcare. We really, really don't need this right now. Thank you.
Across the country, the issue is white hot, with over a dozen states trying to ban gender-affirming care for children.
The onslaught of state laws targeting transgender Americans and their families. It's simply wrong.
The major accredited medical groups, including the American Medical Association, the American Academy of Pediatrics, and the American Psychological Association, all support gender-affirming care for children. After the ruling, the ACLU wrote to the Florida Board of Medicine opposing the rule changes, arguing they, quote, serve no legitimate purpose and are harmful to minors, and that, quote, the proposed rules run contrary to the overwhelming evidence that demonstrate the positive health impacts of gender-affirming medical care for trans youth. Dr. Julia Mason, a pediatrician and also a member of the American Academy of Pediatrics, disagrees.
So they commissioned a systematic review of the evidence, and it found that there isn't strong support for these treatments. So then they concluded these are experimental treatments, and we don't think they should be done on children.
It's the first time a state medical board has gone against the guidance of major medical groups, including the AAP. We asked the AAP for an interview. They declined.
The majority of healthcare providers, the American Academy of Pediatrics, everybody's supporting gender-affirming care. Isn't it possible they are in fact right?
I mean, it's possible that they are right, but my personal experience doesn't line up with that. And when I look overseas and see lots of, countries with socialized medicine, so they have sort of a fiduciary interest in figuring out whether they're spending money on the right things. When I see all of those countries just putting the brakes on and taking a second look, I think that's something we should be doing here in the United States as well.
The Florida Medical Board looked to some countries in Europe, England, Sweden, Finland, which were early to embrace gender care for children and have since reversed course.
We thought that kids under 18s couldn't really give informed consent to medical treatment, which has got long-term implications for them.
Marcus Evans and his wife Susan worked at England's gender identity clinic for minors, Tavistock. He as a governor, she a clinician. Alarmed at what they experienced, they blew the whistle.
Because I was basically saying we need more evidence and more research and studies into what we're doing with these kids. This is a highly controversial service. The children are very vulnerable. There's a very weak evidence base for this approach. And I felt that the trust didn't want to look at this issue. They wanted to bury the problem.
This summer, England's National Health Service shut down Tavistock, citing, quote, scarce and inconclusive evidence to support clinical decision-making.
Do you see any parallels between what you experienced at Tavistock and what is happening in the United States right now?
100%.
So why are major accredited medical groups in the U.S. moving in the opposite direction from England, Sweden, and Finland? Dr. Mason says they're not thinking critically.
My professional organization, the American Academy of Pediatrics, I feel like they got snookered into this. I don't think they really looked at the evidence. I think that they were approached by enthusiastic young doctors who said, hey, trans rights are human rights. This is the new civil rights movement. We need to be on the right side of history. And the leadership of the AAP, knowing nothing about this, but wanting to be on the right side of history, said, yeah, okay, cool, we're with you.
This is such an interesting discussion. NewsNation investigative correspondent Rich McHugh is with me now live. So no one else is reporting this except for NewsNation. What you included in your report, that the ACLU is fighting this Florida ruling, and that means we might see another decision over this?
That's right, Adrienne. So the ACLU had there was a 30-day window where they could argue against this ruling in Florida. They did. They submitted a letter. And now it turns out the Board of Health, the medical board in Florida, will hear this in a new hearing. My sources tell me it will be in the second week of February. It's not confirmed yet, but that's what it looks like. There will be another hearing on this.
All right. One of the countries that you mentioned too, Sweden, just decided they will no longer support gender-affirming care for children at all. How is that impacting what happens here in terms of medical but also legal rights in the United States?
It's a good question. I mean, it's a big step for Sweden to do this. They and other European countries have led the way in gender care for youth. And so for them to say, we are no longer supporting this, we are no longer going to allow mastectomies for minors, is a big deal. They just ruled that. So I've spoken to doctors who are members of WPATH and other prominent doctors in this field. I said, are the medical groups in America looking at this and what's happening in Europe? And they said, they absolutely are. So I would expect that these decisions will influence how we proceed as a country, maybe not in the immediate future, but going forward, and legally as well.
I think a lot of people are afraid to talk about this. They don't want to offend anyone. They want to come off compassionately. They certainly don't want to make the decision for someone else because they don't know what's happening in a child or an adult's mind if they're not in the same shoes. But how does this discussion move forward? I mean, are we going to reach this boiling point where we see changes that will be highly controversial either way?
Well, people are clearly divided on this. So one camp says we are doing this exactly right here in America, and this is the way we are getting this right in healthcare. The other side, if you speak to people who detransition and people who are kind of blowing the whistle, they say we are going exactly the opposite direction. This will come to a head, not anytime soon, but it's going to result in a wave of lawsuits from people who have detransitioned and feel that their rights and they've been harmed by the medical community. So this is clearly building.
But one thing you said when I spoke to you at 6 o'clock this morning, 6 o'clock Central Time, was that they are being targeted. Those who've detransitioned have been targeted. That's been happening for quite some time. Why are people so critical of them when it's, in essence, the same decision in reverse?
It's very curious to me, Adrienne. It's one of the reasons why I wanted to report on this to begin with, because when some of these people who detransition, they transition and then detransition back as minors, they've spoken out and they've been lashed at and they've been vilified. And I thought, this is their personal experience. They have a right to come forward and say this. And so more and more doctors, I spoke to Dr. Laura Edwards-Leeper. She is a prominent doctor in this field. She supports gender-affirming care, but she says, look, we need to listen to these detransitioners. There is value in what they say because clearly there's part of this that we are not getting right.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.